In a moment, the Saudi sheep deal and the Auditor General's report. No corruption is the headline, of course, but in the body of the report, phrases such as lack of clarity, significant shortcomings, lack of transparency, and so on abound. Coming up on Checkpoint tonight, Benedict Collins on what the Auditor General has said and why. What does this all mean? Plus, Murray McCully's response, and David Parker on what he makes of all of this. All of that ahead of us. But before that, a development in a story we first brought to you last Friday. This is Vicki Letele, the terminally ill woman with a life expectancy now of less than 6 months who has failed to gain an early release from prison. Sentenced to 3 years imprisonment back in March and September, having been seriously ill for some weeks but not diagnosed, she was finally taken to hospital where she was diagnosed with stomach cancer that has spread throughout her body. A first appeal to the parole board for early release was unsuccessful despite her entire medical team insisting she's too sick to be adequately cared for in prison. On Thursday, she was rushed to hospital for the treatment of complications arising from her illness. Tonight we can reveal two new developments. One, that the Chief Executive of Corrections has requested a review of the case and its health management. A review has been requested. And a second development detailed by Vicki Letele's uncle, Ula Letele.
She's been returned back to the Wiri facility for women from the hospital.
So she has left Middlemore?
She's probably on the way back at this very moment.
As we speak?
As we speak.
And you have tried so hard. The family has tried so hard.
Very hard, very hard.
In fact, her doctors have made a compelling and singular case for her to not return to Wiri.
Correct. And we're still trying, we haven't given up. When you consider that all of the doctors' advice have been to return her to her home because she's best cared there, it's being ignored. And when you consider that that meets the criteria of one of the 2 points that enable the success of a application for early release, and that is the facility is unable to take care of her, and the medical fraternity is saying they cannot, and yet they still go against the medical profession advice. It just, I don't understand it.
Forgive me, because these are tough questions, but Vicki's guilt is not in dispute, and the appropriateness of her serving jail time is not in dispute.
Absolutely, no, not at all. She's made a mistake. It's an honest mistake, and she's paying her debt to society. Except the difference being is that prior to becoming aware of her illness, it's now a death sentence. She has, from the time that she was told that she had terminal cancer, she was told that it was less than 6 months. Well, that was in September. We're talking November now. So the clock's ticking. There's 2 or 3 months left, understanding the context of what the medical profession have told us. It's a terminal prognosis.
Ula, forgive us for doing this, but lots of people want to be certain of that fact when they discuss this case. Yes. And so today we called Vicki's consultant surgeon, and she's had a lot of people looking after her, but this is the man who did the operation to remove the tumour. So he's Mr. David Moss. He's a consultant general surgeon at Middlemore, and this is what he said about Vicki's condition.
Really, Vicki has incurable disease. We did surgery. We were able to remove most of her stomach cancer, but it had spread already, and we were not able to remove all of it. And unfortunately, stomach cancer is notoriously poorly responsive to chemotherapy. So while Vicki is having chemotherapy with the idea of prolonging things, really I don't think anyone would believe that there is other than a very small chance that this will cure her. Really, it's minuscule chance that she'll be cured with chemotherapy. The idea of this chemotherapy is to prolong things for her and give her, hopefully, some improved quality of life for what I think is probably a matter of months she's got to live.
So that's David Moss repeating exactly what you were just saying and what you went to the parole board with. Now, all of this has happened very fast. Vicki wasn't even diagnosed till September, right?
Correct.
You've gone to the parole board with one application. They have said no to this point, but there are grounds explicitly for you to go back to the parole board, aren't there?
And they're really based on her condition and the deterioration of her condition. So really what we're saying, if you think of it in layman's terms, it's until she gets sick to the point of death, then they will not release her. Because as part of the second criteria to the opportunity to apply for early release is her demise being called imminent. Now, imminent is 3 to 5 days. Now, if you listen to what Dr. Moss was just saying in terms of chemotherapy providing a delay, or rather trying to improve her quality of life, well, it's to improve her quality of life so she can live it to say goodbye to her family. That's what you would incorporate as being a quality of life, not waiting until she's on her deathbed to be then transferred to a hospice and to die. There's spiritually, culturally, morally, you wouldn't treat a dog in the same way. And that's what the family is. We don't deny and she's owned up to the mistake that she made, and we all make mistakes. But we just want to take her home. We just want to love on her. We want her also to be able to love and to say goodbye to her partner and to her children, and do it in a way that any human being ought to be allowed that dignity to be able to say goodbye.
When did you find out that she was going back from Middlemore to Wiri today?
Just this morning. I visited her early hours of this morning and was told that she was being returned.
And how is she?
She's in good spirits, but she's a strong girl, so she doesn't show you the full extent of her pain. She's going back with the knowledge that while she continues to undergo, and as it gets further into the treatment, that the same thing that's happened to her now, you heard what Dr. Moss said, it won't get any better as she's going through it. Well, in fact, halfway through this first 6-week program, we're into the second week.
This is of chemo, right?
Of the chemotherapy. She then now undergoes an infusion, which she has to be hospitalised for. Now, currently...
So she's going to leave Wiri and go back to the hospital?
She will go back to the hospital.
Have the chemotherapy infusion?
Correct.
And then go back to Wiri?
Well, we're assuming that might be the case, but we're, God willing, that the second application that we put in, that's demonstrated that if the facility were able to take care of her, she would not have had to go from the facility when she was ill last Wednesday, admitted into Middlemore Hospital on a Thursday and only released again today. So that in itself beggars belief that if the facility is saying that they can take care of her, but yet she's had to be hospitalised to enable her to get... you see, that the facility is unable to administer opiates. It's just not allowed to do that, morphine and things like this. So it's a little bit trying to second guess her next reaction or her next need.
Can you describe the circumstances in which she's living? Because the thing about chemotherapy is that it knocks you about.
Correct.
So not only does she have terminal cancer,
Correct.
but there are a whole lot of things associated with that,
Correct.
particularly the kind of large doses that she's about to have.
Yes.
So that her immunity is somewhat
there is no
compromised.
immunity.
Right. So where is she living?
She's living in a communal home that accommodates 4 people.
So she's in there with 3 other women?
There's 3 other people that live with her. She's in a room that is several metres away from a call button if it's required. Now, I know that there are times there that she's been in excruciating pain and not been able to leave her bed, to be able to walk those metres, to be able to press the button, to get relief. And normally it takes 20 to 30 minute sort of time delay for someone to then respond from the medical centre. And because some of the drugs that she's on have to be kept away from her for obvious reasons. There's all this time delay in terms of being able to respond to that particular need, which if she's in either a home environment where we would be able to provide her with the palliative care that we've been told is available, and also within a hospital, and it's instantaneous.
So if the facility was designed for this type of illness, in other words, if there was good care there, if there was instant pain relief readily available, if people were able to get to her, if there were nurses on standby the whole time, if the call button was beside her bed, if the family had access to her, you would not be opposed per se to her being in that situation.
No.
So it's about the ability of this corrections facility to care for her as you believe she deserves to be cared for.
It's not designed for this type of patient, and I believe that it's the only one that's, Vicki's the only person that is there. It's a medical facility that takes care of, I can't describe it, but anything less than the seriousness of dealing with someone that's A, got terminal cancer, and B, that's on a 18-week chemotherapy program.
So you're going back to the parole board?
We're going back to the parole board on Friday.
And the family is taking this appeal itself, paying for this appeal itself?
It's been, yes, we are. Yes, we are.
And your message to the parole board will be what?
Is to show a heart, show some humanity.
Ula Letele, who was Vicki Letele's uncle, speaking to us earlier. So we just want to reiterate on a couple of developments this afternoon. Firstly, Vicki Letele has been taken back to the corrections facility at Wiri from Middlemore Hospital, where she was receiving treatment for complications arising from her illness. Secondly, the Department of Corrections has ordered a review into the case of her care and treatment. And the Corrections Minister, Judith Collins, was asked about Vicki Letele's case on the bridge earlier this afternoon. This is what she had to say.
Corrections Chief Executive Ray Smith has spoken to me today on this matter and advised me that he's asked the Chief Health person or doctor at Corrections to review the decision. So it's ultimately a decision for the parole board, but obviously Corrections makes recommendations, so they're reviewing what that Corrections can properly look after the prisoner, and so I think that's where it is at the moment.
So this is very much a work in progress, and we will update you if we hear anything more on this case.